Welcome everyone to Doctoral Writing as a Nurse, writing about quality improvement projects. This is a brand new webinar that we are offering in response to the demands and requests of students such as yourself. So if there's a topic that you would love to see a webinar about, please feel free to send us an email, or when you register for one of our webinars, just put in a little note, and we are certainly happy to take those suggestions into account as we're planning each schedule. This is one that I had several students write in saying they enjoyed the walkthroughs for different assignments, but they were looking at a assignment they had to do at the end of this term and wondering what would they have to do? How is this different from some of the other papers that they have addressed? So if that describes you, you're in the right place. And if you're just dropping in to see what this is, you're certainly more than welcome to stay. We are getting close to the term, so you've probably encountered the Writing Center already. But if not, we work with students at any step in the process. You can be just looking at the instructions and wondering, how do I begin? And do I need to do this? Should it look like this? Is this appropriate? And send us those kind of questions. That's fine. You could have an outline and you're asking, does this make sense? Does this follow a logical order? Or does this look like it would do the things that the assignment is asking? Then you can do that all the way up to and including a full draft. We even have some students who, after they get their grades back at the end of the semester, come to us during the intersession period in the week 0 period between the terms and say, I had this paper, I wrote it really quick, I'd like to know how I could do better. And that's totally fine. We're certainly happy to help. The only thing that we can't help you with, we can't write the paper for you, we can't copy edit it, but pretty much anything else is fair game for getting another set of eyes. So our basic process that we work with students is through what we call asynchronous appointments, meaning these don't happen in real time. You can log into our WC Online scheduling system, reserve a slot. By the time that appointment comes around, just make sure you upload your paper for us to look at, and you'll get feedback from us via email within 24 hours. Now, we also work with students through webinars such as this one here. And we've got one coming up on the schedule next week that is Writing a Leadership Assessment MBA edition. If you are enrolled in our Doctor of Nursing Practice or Education Leadership programs, you'll probably know that you have other assignments in your own programs that look at leadership assessments, but we're going to be focusing specifically on an assignment in the MBA program. You're welcome to come. There'll be a lot of stuff that you can apply to those other programs as well, but we'll be specifically focusing on an MBA assignment there. To view the recordings of this and any other webinars, you can go to the Online Writing Center website. I've got the link here. And we post these generally within 24 hours of the webinar. So if you miss one or have to go early, that's not a problem. And we also send a link to the webinar recordings to everyone who has RSVP'd for the webinar. Now, if you've come here now and you're thinking, gosh, I don't know if I RSVP'd, just type your email address in the chat window and I will make sure to add you to the list that gets these. This is part of a series of webinars that we have about doctoral writing as a nurse. So if you're thinking, well, let me see if there's something else in my program that you've got something on, well, we have some targeted points where we have seen a lot of questions, and from talking with faculty, we've learned this is something that students benefit from a little bit more guidance. And we're expanding this every term. So come back next term and you'll find we have some more things too. Now, our main content today will be falling under 3 different learning objectives. First, developing an understanding of quality improvement projects and papers, developing an understanding of the specific QIP assignment that comes up in the class we're looking at today, and how to create a working outline for writing your QI paper. And we'll go through these in that order. First off, if you're wondering where these things I'll be showing you are coming from and how can you get that yourself, here are some links for you. I will go ahead and I will type the link to download that course paper template in the chat room. And the quality improvement in class, well, to have access to that, you'll need to be enrolled in it, but you can just look at your upcoming assignment for the end of the term. Some other links you'll see me showing here as well. This is just a quick reference to some literature about quality improvement projects, and you'll see me showing these in the web browser in just a moment. So what is a quality improvement project? Well, we'll talk about some details there, but one of the things I do want to impress is that this is a professional genre of literature. This isn't just an assignment that you're working on in the class. It's something that you might publish, that you might implement in your practice as a nurse, especially if you are moving into more of a nursing leadership role. You'll see here, just searching for quality improvement project in nursing comes up with more than 27,000 results. So there's quite a lot that's been written on this. Even if we look at just stuff that has been published in the last year, you'll find that this is a high growth area. There are more than 7,000 sources here that Google Scholar is aware of that have been published in just 2019 or 2020. So there's a lot out there. And if you're working in healthcare in the United States, you know, we've got a lot of things that could use improving, and current health conditions this year have showed us that there are even things that we didn't imagine before that we're discovering we need to work on. So you can find a wide array of literature at your fingertips if you're wondering, well, what does a QIP paper look like, especially in a professional setting? Or what if I want to take this and eventually adapt it into a journal article? So, for example, this first one is an article that was published in the journal Nursing Economics. The second one looks like it is a doctoral dissertation. The third one is a QIP that was published regarding an intensive care unit in a journal article. And you'll find that these go all over and cover many different fields, including adjacent ones. And that is speaking to the ubiquity and the need. So if you're working on this assignment, you know that the rest of the world has a lot of need for this. And I hope that you do more than just write the assignment here. Let me turn the screen back to my slides here. If you're wondering, the second link is one directly to the ACU Library. It will require that you log in to access that. So if you're on your mobile phone, perhaps the Google Scholar link will be more convenient for browsing around. The ACU Library link will allow you to download PDFs for anything that would normally require your ACU subscription. So what is a quality improvement project? Well, you may have heard of it already on the job as a quality improvement plan. In healthcare, it refers specifically to systematic activities that are organized and implemented by an organization to monitor, assess, and improve its quality of healthcare. And we'll zero in on those in a moment, but let's look at those verbs again. Monitor, assess, and improve. And that's an important distinction because a lot of research is designed not to make the change directly, but to look at it and just find out what's there. Here, it's not only looking at what's there, but evaluating it, doing that assessment and saying, okay, here are things that aren't working as well as we'd like, or here's an active problem we need to solve, and then trying to change it, the improvement. And of course, you need to measure the results after you've made your changes and see, is this working? Is this doing the things that you want? Is it doing the things that you prioritized? So what about that specifically? Well, first of all, because we're dealing with actual workplace settings, it must be evidence-based. It would be irresponsible to not do that. And again, because this is dealing with real patients, it's not generally experimental or designed to produce understanding insight as the end goal. That might be part of the process before you propose the actual project, but we're trying to create discrete, measurable improvements. And so there's going to be a lot of looking and seeing, okay, what are the best practice guidelines here and how can we implement them? Or sometimes, what is it that you can observe as a clear practice gap between what you know experientially and is grounded in the literature should be happening versus the current reality, and how can you shift the current reality towards that ideal. Now, QIPs are often, especially in today's healthcare environment, often linked to external funding. There are a lot of grants that can be linked to that. There can even be Medicare and Medicaid reimbursements where if you've had a number of errors at the work site, at the hospital or the clinic, where the compensation is pinned in some part to meeting certain improvement guidelines. And so one of the reasons that there's so many quality improvement projects being published now in the last 12 years or so is because the Affordable Care Act mandated certain ways of managing improvements, and QIPs give clear plans about how to do that and how to implement it. So that is one of the reasons why we saw so many publications from just the last couple of years. Now, the QIP has to describe an important issue or opportunity for improvement, and want to emphasize that second part. It's not always that something's bad, per se, but that it could be made better. That could be cheaper, that could involve less waste. It's not necessarily patients are bleeding out and dying, but here's an opportunity to improve the process, whether that's turnaround time, refining triage, cutting down on medical waste. For example, an issue, high incidence of medical errors. This is an extremely important one because, first of all, we're dealing with medicine, so errors can have severe and lasting consequences on patients' lives. And also because, as I said earlier, government reimbursements and insurance reimbursements more generally can be linked to these. And if you've ever put in the billing paperwork and then had to redo it because of a transcription error or something like that, you know, that's a lot of time that you could spend on other things. So I've seen people do QIPs that involve, they have a handy quick reference chart. So people aren't trying to remember all those codes at the end of the day. They have the most common things on a laminated, disinfectable thing that's attached to the computer monitor. That may sound very simple, but I can tell you that the student who implemented it, it tracked the number of hours that were reported as being saved. And when you're talking hundreds of staff hours, that adds up to some significant money, especially because it's not just for the trial period, it's also everything thereafter. Now, an example of opportunity, anything that has room for improvement. One of my students did a QIP involving a medicine supply cabinet where there were materials with expiration dates. And she noticed that in her years there, they've kept throwing out stuff, about twice a year they go through and find a whole bunch of stuff that expired. What was the main thrust of the improvement project is actually creating a hardware system where the cabinet was designed to place things in by order when it expired. So you used all the stuff that was going to expire sooner before you used the stuff that had a longer shelf life after that. And that may sound simple, but she had to get that through multiple layers of the hospital process to train people to follow that, so they weren't just shoving things in any way they could. And it was a whole process to do. It was a real bona fide project. But when she was proposing it, she pointed out that they were throwing out more than $60,000 worth of materials every 6 months. So when you are saving the hospital the equivalent of one full-time person's salary, at least per year, that adds up. And when you identify these things on the job, if you're not doing this assignment yet, just take mental notes because you could be coming back to doing this as your assignment in this class. So again, the focus is not so much the advancement of knowledge, it's to identify an issue that can be made better or removed or alleviated. So these are often crafted as an actionable plan for implementation in your own workplace, the place that you are working when you're not attending our classes here. If you are dropping in from another program and wondering, well, if I'm, say, an MBA student, can I propose a QIP for the firm I'm working for? Absolutely. And I've seen a couple assignments from that as well. Our examples here are just going to be mainly focused on nursing today, but certainly these principles can be applied to other areas as well. And if you're wondering, yes, I hear a lot of reports from students about what happens after they turn in the paper. And very often, because they've done all this work already and they've written for their specific workplace, they go in and turn them in and often are able to actually implement them, which is very satisfying to see what you've worked on in class also help you out in your professional life. And although I wouldn't say it happens all the time, especially as some portions of the Affordable Care Act have kicked into place regarding improvement, a couple have reported back to me that they got bonuses from successful QIPs. Can't say that will happen at every employer, but it is a nice bit of icing on the cake. So let's look at the specific assignments, and I'm going to switch back and forth between my web browser and these slides because I'd like you to see what it looks like when you are viewing it as a student, as well as a portion I've extracted here for our purposes. So first off, what is this assignment? Well, let's quantify that first in terms of length. 6 to 8 pages. So 6 to 8 pages of the body. Let's discount the cover sheet. Let's discount the references. 6 to 8 pages, that's going to be somewhere between 1,500 and 2,000 words. If you're wondering how to get that, a double-spaced paper, 12-point font, 1-inch margins around the sides, that works out to about 250 words. So 1,500 to 2,000 words, which may sound like a lot, but once you go through the list of requirements, you'll find that actually if you do everything the instructions tell you to do, you'll end up with right about that amount. So write this paper on a quality improvement issue that is relevant to your current clinical practice. So it's supposed to be about your workplace. This issue should include both a policy and process aspect and require improvement in both of these areas. So it can't just be we're training the people around us to do something differently. There should be something to continue this and ideally align things at the leadership level. So a project that was just, oh yes, all of us nurses in this ward decided to do something different would probably be missing out on the policy aspect. You'd want to get leadership buy-in to make it a policy that we are going to do this thing. You also need to explain the quality improvement issue in a clear and succinct manner, providing details on both sides of it. Okay, good so far. To evaluate the current state of your organization as it relates to the identified quality improvement issue. Now, I get questions here about how to write about your work site. Now, not asking to do anything that would violate HIPAA. Nothing about specific patients should be going in here that might lead back to them. But you can talk about things in general, and you can also choose to what we call de-identify or anonymize both patients and your site. What do I mean by this? Well, you might refer to someone as patient A instead of their name. You might refer to the study site by a pseudonym or just describe it as a mid-size rural health clinic located in the American South instead of this clinic at this specific address, which, if nothing else, might make you wonder what your coworkers might think while reading it. You also need to determine the specific strategies that are going to be used to improve this. And you need to identify these using a specific process, the Pdsa that we'll talk about in a moment. And the instructor wrote that you should include a brief conclusion that summarizes the main points of your paper. All right. Well, let's go into a little bit more detail about what's included. You need to include a SWOT analysis of the organization to describe the perspectives of the different stakeholders inside and outside. Map out the processes that are going to be followed and include a flowchart diagram and identify any problems or bottlenecks that exist. All right. And you need to analyze how economic, ethical, political, legal, or other organizational factors are related to this. Okay. And then you'll find that the number of things that you need to do expands, and that the instructor is actually given very detailed instructions about how to do this. So detailed that it flows off the page here. And more details on that. So let's step back. Some of the key elements identified: the length. Definitely want to not write more than you have to, and not write less than you need. You need to identify a clear work placed issue, to analyze it using Swot analysis. SWOT stands for strengths, weaknesses, opportunities, and threats. And yes, you should discuss them in that order. You need to propose strategies for improvement using the Pdsa or Pdca system. That's planning, doing, studying, and acting. And the only difference between Pdsa and Pdca is that some places use check instead of study, but it means the same thing. So if you've done Pdca before for an assignment or for at work, you know exactly what a Pdsa is. And you need to refer to at least 4 outside sources and include citations in a reference page. So remember when I was showing you that link to search results? Well, if you're looking for some literature that you might be citing, then you certainly do want to go searching and look at some of those. I recommend it being recent literature, because things that predate the Affordable Care Act are generally a little bit less relevant than more recent sources. Now, I saw an excellent question in the chat room. Can we use SOAR instead of SWOT? Well, for this purpose, I'm going to turn to the assignment guidelines here. So I'm going to bring up this course in my web browser, and we're going to look at what the instructions say and how to navigate if you are looking to, shall we say, do a variance from as written. So I'm just going to change that over. You should now be able to see my web browser, where I have the quality improvement paper assignment for Nursing 731 pulled up. Now you'll see here that the very first bullet point specifically says include a SWOT analysis of the organization. So my general reading would be to say only use SOAR if you've had a specific note from the professor saying that you can. Now, we're a couple weeks out from this assignment being due, so you could certainly write the professor now and say, hi, I've looked ahead, I looked at the week 7 assignment, I would like to use SOAR in place of SWOT. And that's a simple yes or no question. I believe that has been approved before, because I remember reading a student paper that used SOAR for this assignment. However, it's not always the same professor teaching this assignment, is teaching this course. So it's always best to ask. And then in case there's any question later, you can say, oh, here's your email saying I could do it this variant way. And that just anticipates any questions. Good question. And I encourage you to ask questions as we go along, because I can talk about this all day, but it's much better if I talk about the actual things that you want to see and hear here. All right, so we see that this is broken into a number of different bullet points for evaluate. We have these very detailed guidelines for determining the strategies that you're going to be using, and some specific questions to be answering in this section. And don't forget to look down here at the rubric for the grading, because this actually gives us some additional detail on what should be in here. And yeah, yes, there's some overlap here, but you know that, oh, these 2 sections are collectively have 15 points. That is basically a little bit less than 2/3 of all the points for the assignments are for this chunk here. So if we view this area where you explain the issue, as the introduction. This is the heart of the paper. And then a brief conclusion, okay. General formatting, general writing standards. So most of the points and most of the content should be with these areas too. So when we move to an outline, we want to make sure that the outline reflects that length and that level of detail. Other things to look at here. Well, reference at least 4 outside sources, meaning outside of the course reading, and include in-text citations and a reference page. Sure. So at this point, I'm going to ask a couple questions for the people in attendance here. Is there a general issue or a specific issue in healthcare that you are interested in? Because I need to do some searches for literature, and if you let me know something that you're interested in, we can use those for examples, rather than just going by what I think happens to be interesting and cool. So if there's something that you're considering writing about, mention it and we can look at it here. I'm going to start out here by going ahead and looking at one particular aspect of quality improvement that I think is very relevant to the current situation. And this is protective equipment, PPE, you may have heard it. And so we find that without my even having to put personal protective equipment in here, you'll find that for some reason there's been a lot of this published this year, which suggests that it is a relevant issue. And I'm seeing a suggestion in the chat room for COVID PPE reuse. All right, so we're going to expand our search here. I'm going to go ahead and I'm going to put in personal protective equipment in quotation marks, meaning I want Word to search for, sorry, I want the Google Scholar to search for that word string together. And I'm going to put in COVID and I'm going to put in reuse here. And let's just see what comes up. Now, at the first search, we only get 3 results. Now, that's not entirely surprising because this is a relatively recent phenomenon. A relatively recent meaning, oh, probably since February in Europe and March here in the United States. But I bet there's a little bit more than that. So one of the ways that we might broaden our search is to look at it and say, well, we already knew that QIP could stand for Quality Improvement Plan or Quality Improvement Project. Let me go ahead and take project out of here and see if that changes the results. And you'll find that I go from 3 to 43, which is a pretty significant difference here, especially since we're talking about things just in the last year. We've had about a 14-fold, 14 times over increase in the results that we see, which means that we might be able to be more particular if we have a particular interest like, say, visors or math, those are face shields. So let's search for visors. That doesn't bring up a lot. We search for face shields. We'll find, oh, about 30. So if you are interested in a particular area there, there's room, once we've removed an unnecessary restriction there, to see more. So let's go with the, I would say still the scarcest thing, the N95 respirator. And so we've got 22 results here, some of which you can just go ahead, click, and go right to the web page here. But I'm also going to go ahead and I'm going to take this search string here, and we're going to go to the ACU Library, and we're going to search for this exact same search string here. Now, Google Scholar is very handy. There are things that it does not see, does not have access to, that the ACU Library search can get you to. And what's more, with just a couple clicks, you can download as a PDF. Now, how you search matters. As this brief search here, just plumping that all in as keyword, is coming up with this particular program here in Philadelphia. And you'll see that this is not coming up with a whole bunch, and in part because of how we're searching for that. So we could go ahead and change this a little bit. Let's go ahead and let's take personal protective out. And see, what do we get? So we get more here. So this is one of those points where I want to emphasize searching in one place usually means you have blind spots. Google Scholar happens to be very good at getting extremely recent things that have not necessarily been populated to the ACU search database. And with COVID, there's just so much coming out because it's a current active issue that you might run into this, what we call an indexing gap. If you think that there should be more stuff than you're seeing, you can always call our wonderful librarians or set up a research appointment, even email them the link that you're searching and say, hi, this isn't working, help me out. And they'll get back to you and send you suggestions, which is great. Let's go ahead and look at this article here, because this is looking at one of the early proposed methods. It's for sterilizing an N95 mask to reuse it. And I can tell you that located in the Twin Cities metro area here, there is still a lot of N95 mask reuse, even though we are in the state that is manufacturing the most masks in the United States. And that means that you could be working on a very relevant PPE project, a quality improvement project about PPE that you yourself may be using at your workplace, because it looks like we may be having to do this for some time. So you'll see here that there is a link here, as well as just access to your institution. Now I can tell you ACU has access to Science Direct here. When you're coming at it from so-called the outside world, you may run into things that involve you're then going and finding, searching for the Science Direct database in the library catalog, because again, it's there, but it hasn't been indexed yet in our library catalog. But we'll find that we have actually the whole article available here. Great. You can read the whole thing, we can skip down, and if you're trying to determine, is this something that you would consider using for your QIP, you probably want to go ahead and skip down to looking at the results and the recommendations. What did they find? So we could go ahead and look at, say, this chart, and we see, okay, there was a small drop, even through 10 cycles of sterilization or reuse, but the difference is not significant. Okay, that looks like it might be of interest. And looking at this other method as well, oh, that's looking pretty good. And all right, I just want to go ahead and look at the discussion section. And I'm not trying to read everything here. I read quickly, but not that fast. What I'm trying to do is go to the section that I know will have the most important results for my understanding. Is this something I want to spend more time on? Do I want to download this and read it over dinner, or put it into a folder of things that I'm considering using? So we see that they recap some key things. All right, they were using this percent of hydrogen peroxide for their decontamination. And they situate it within the literature. They're saying they're building on earlier studies. And if you're doing a QIP, you want to make sure there's a secure foundation for what you're doing. So seeing, oh yes, it's building on the earlier studies and aligning with that, great. It's dealing with an active issue where there's a dearth of knowledge, good. And the finding that both mask fit, very important for that air seal, and filtration efficiency are not affected by using this within the period that they test, which is 10 cycles of decontamination. I believe my local hospital is at, they have the main stock, which you use once and then move into the sterilize and reuse, and they use those for up to 4 cycles. So this is good, especially if you're looking at, okay, in an emergency, we could potentially more than double our reuse cycle by using this method. Great. So I'm going to say this is time for me to download that and save it on a folder in my hard drive so I have access to that. This looks like something I might be using. And let's go back and look at the assignment. And so we see, okay, there's literature related to our topic. We found more than 40 studies on this from the last year. And although I only grabbed one now, I'm pretty sure I can do this. And I'm pretty sure it's a thing I want to write about. All right, so I am going to go ahead and I'm going to grab a copy of our APA course paper template. If you joined us late, that is the link that I shared earlier. That is the tiny.cc one. And that's just a link to download a copy of the template. If you haven't used our template before, it does a lot of the APA formatting for you. It has built-in styles to help make things look the right way and spaced. And basically it just saves you a bit of work on your paper and makes everything look consistent in a nice professional way, which according to the rubric, you are being graded in part on that. So I strongly recommend using the template. And one of my students says this is best of all. Because I made the template, if you have problems with it, you can email me for help with it. All right, I'm going to go ahead and change my screen sharing now here so you can see this template. All right. And as you can see, a lot of this is just waiting for you to go in and fill in your name, the title of your paper, and things like that. Please let me know if the text size is too small for you to read clearly. I'll be zooming in and out as we move around. So you can see that I've got some instructions on how this works. You can watch a video. If you know the drill, you want to clean up all those comments, just go to review here on the ribbon, and you'll see that there is an option here. We can delete all the comments at once. There, nice, clean, ready for you to fill in. If you're not including an abstract, and this assignment does not require an abstract, just go ahead, select this, delete, and we're set, ready to go. So I'm going to start copy and pasting things in from the online instructions. So if you're wondering where this stuff is coming from, it's just coming from the course paper instructions that we were looking at earlier. And then I'll walk you through the process that I recommend using to build your outline. All right, so to start out, I'm just going to clear out this text here. And I'm going to paste from the Canvas website. And I'm going to use a specific option, paste and match formatting. Now, if you just went ahead and pasted, you'll see the font doesn't quite match. The spacing isn't quite right. Now, you can always select that option, match destination formatting here. But if you're wondering how to do it directly, you go to the upper left-hand corner, you select edit, and then you'll see paste, match destination formatting. There. So now it looks more like writing an APA. And what I recommend doing is just starting at the top here, and then go ahead, take the bulleted list tool, and start a list. Because what this does is it gives us a way of tracking what each thing you're supposed to be having is and making sure that you have taken note of it. Now this first thing, 6 to 8 pages, okay, I got that. I can take this out. But looking at the order of things, see, oh, this is something that the instructor has given me a directive for what to write. So this is going to be my introduction. And I know, oh, well, first thing I need to do is explain the quality improvement issue. And to do that, I also need to identify my current workplace. And probably as part of that, to explain my insights in there, also include things like, what's your role? How long have you been there? So a lot of our students propose quality improvement issues that deal with the specific ward or clinic that they're working in. And because it's something that they have a lot of experience with, and that uh, leadership at the site is more inclined to give them access to. You know, if you just pop into someone's else's ward and you say, "Hey, everyone, you're doing it wrong," this may not go over as well as if you're talking to your colleagues and saying, "Hey, I think we can do this better," all of us as a group, uh, especially if there's leadership buy-in. And we see here, uh, okay, so after you've given the quick introduction to the issue and then explained the context of your workplace, which could be size, setting, patient populations, things like that. One of my students works at a healthcare clinic in rural Tennessee. And you might think that rural Tennessee would mostly have people who are Caucasian and English speaking, but it happens that Tennessee has a lot of Hispanic immigrants who don't speak English. So one of the issues at her clinic is that they have lots of patients presenting who are fluent in Spanish, but not terribly fluent in medical English. For their everyday conversations and work in English, they might do fine, but they're not actively using or acquiring the medical vocabulary in English. So that creates a very particular need that she has identified there. And so it could be that there's an issue with a specific subpopulation, as is the case in that particular site. And in that case, one of her entry points there is that she does happen to speak Spanish and it's acquired medical Spanish. And so part of her QIP involved coming with a mechanism to disseminate that, to train her colleagues there and have it be something where it was just part of the onboarding process that you would orient people to those resources and give them a basic foundational vocabulary. Because, you know, depending on your setting, you might pick up a lot of a language in your everyday life, but not have that specialized stuff. I can certainly order in a restaurant in Spanish. I couldn't talk to my pharmacist in Spanish. All right, so once you've gone through and you've seen, okay, I've taken care of everything there. Okay, this is telling me details on policy, details on process proposed. Now I can go and I can either, depending on how you like to do this, I could use the cross out tool and mark that as done, or I could just delete it. And some people will do both. So up to you. And I see, okay, well, that's going to be the introduction. And because this is a paper of 6 to 8 pages in length, that's not small, that's about 2,000 words on the larger side. We should probably have an outline paragraph. What's an outline paragraph? It's a paragraph that lays out the major sections of the paper so your reader knows these things are coming, will delay questions till they get to the relevant section. It also gives them a sense of how everything is going to fit together. And what should we do here? Well, we're going to march through and pick out the major themes of these instructions here. So we know that the two largest parts of this outline and area are going to be determine strategies and evaluate the current state of the organization. But within that, again, because this is a somewhat substantial paper, 6 to 8 pages, there's going to be subsections of that. And you might look at this and say, okay, I'm going to use all of these in detail, but really here, we're just talking a sentence or two per thing and say, okay, all right, well, that's going to include SWOT, and processes, and the factors. And then go ahead and do that for the rest of the stuff here. So if you're wondering, what would this look like? I could just write out something and that says, for example, let's do it this way. I'm going to bold this so you can see that the text that is being proposed as meeting this, or just growing crib notes. And just fill that in with all the different things that you're going to mention. So will it be a longer sentence? Probably for something of this length. A lot of these are things where it's a list of things that you will discuss, but that don't necessarily merit a whole sentence on their own. But if you're ever going to have a long list like this, saying, okay, here are the major sections of the paper, that's fine. And it's clearer in that you're listing things in the order that you're going to be discussing them. And so just make sure that you go ahead and fill these in. But I tell people, don't worry about having your outline be complete at once. You can always go in and fill in more bullets and more details later. What's important is that it grows over time and become more specific to help you out when it comes to the writing. So I know that outline is going to grow. Done with that. And let's start layout. Okay, we're going to have area 1, area 2, conclusion. And I don't need to put something in for the references. I know I'm going to have references. Oh, speaking of references, let's go back and look at that study we were looking at for QIP. So let's go ahead and pick one here. This particular study we're looking at, it takes us to the Science Direct page. Now, if you were to just go ahead and copy and paste this into your reference list, you'd have to do a bit of cleanup here. And if you're wondering, why isn't this particular one showing up in the ACU library, we can see it's even marked as, oh, it's a pre-proof. So it's being posted online, but the formal printed journal volume has not gone out in the mail yet. So that's probably why it's not showing up in the ACU library just yet. When there's a pressing global health issue that like COVID, or before it Ebola or MERS or SARS, often they'll make these things available so people can use them, while acknowledging that the print process will take a little while. So if I went ahead and opened up this PDF here, you would see that it has stuff in a different format, which a little bit cleaner if you're copying it. Still some cleanup that you might have to do. Let's go back there and look at the different buttons, because each database will have some mechanism of giving you some of the citation information prepared. Now, if we went to export here, you'll see that there are a number of different formats here. If you're using any reference manager like Zotero, which our library staff will probably encourage you to use, and does save you a great deal of time on your dissertation. But if in doubt, you can just go ahead and go to the text file, because that will give you the information in a fairly clear and easy to read format. And I'm just going to copy and paste this back into the Word document. So we're switching screens. And if I go down to the references area now, get rid of these placeholders. and I just go ahead and paste this. Okay, I have to do some cleanup here, but it's mostly in the right order here. So, all right, that's a first name, need to put that in here. Now, why would you want to not just copy and paste directly from the website? Well, often the format is arranged in an order that makes it look better on the website with things like larger text and stuff, but causes extra work when you are importing it into Word. Now, if it was appearing in the ACU library thing, there'd be a handy dandy cite and APA thing that we could copy and paste. But because this is a pre-press, as we discussed earlier, it's not quite there yet. And some other things we need to do here. This is written in title case, and we want to have this set into sentence case. So you'll see this button here, change case. It doesn't always work, depends on how the text is being formatted, but often we'll be able to do something like that, where you see, rather than fix the capitalization in all those, I can do it all at once and then go in and recapitalize COVID. And then that's all I have to do to get that title in sentence case. So let's look at the rest of the information there. We have the American Journal of Infection Control, and there are no pages yet because this is a pre-press thing. Now, that may come later, but we're going to go ahead and look at the website in just a moment. So we have our journal title here, and I'm going to go see if it has been ascribed an issue yet, or if it is pre-press, as in the full sense. They haven't assigned it to a specific journal issue just yet. And there are things that we will do if that's the case. All right, now in the background, I've taken a peek there, and it appears that this does not have an issue number just yet, or even a volume number. So I'm going to go ahead and pop out my copy of the AP manual. I'll be back in just a moment here. And if you have a copy, what I'm doing is I'm looking up the section on what are called preprint or pre-publication copies of an article. This is on page 394 in the manual. And I'll show you exactly what it says to do in a moment. But if you're ever in a doubt, you have a source here that you want to use and you're not sure what to do, just go ahead and send us an email and we can guide you through how that formatting should use. Just make sure you include as specific information as possible. So looking at this here, we see that there are various guidelines here about how you should describe those. But the short answer is that if you have material that's pre-press, it needs to be tagged as pre-press. And I'm going to come back to this in a moment after I grab the relevant online website. Just a moment. The website for these things is apastyle.apa.org. I'll share that link in the chat window. And one of the very handy things that they've come up with for APA 7th edition is that they have posted a whole bunch of examples on most things you might think of. If you were using the OWL Produce site to look at examples in under APA 6th edition, the official APA style website has them much better sorted, so it's a lot easier to find the specific thing that you're looking for. So just a moment, And I'm going to go ahead and share my screen here. And I'll even share a copy of the link for this specific page. Oh, and my colleague has shared you another page with examples. So we are looking at a case here where we don't have all the information because it is preprint. So you'll see that there are cases where people will just note that there's missing information by leaving it out. And sometimes you'll have something published online that just doesn't give article numbers and things like that. So we can use that. But in our case, there's an additional note we want. We want to make sure that it's known that this is not a published thing. This is something that has been pre-printed. And if you turn in APA 7th edition to page 337, there's an example of when they show a preprint article. In this case, it used to be tagged much more specifically with a bracketed note saying preprint. But in this case, because we have the DOI, the digital object identifier, that will always take people to the most current thing. So in previous versions, we would have marked it with a note to a greater extent than we do now. What we will do here is we are going to take this out because 2020 is not the volume number. And we're just going to say, all right, we have the title, we've got the journal and the DOI. And then when it's assigned to a volume and issue, then the DOI will lead you to that finalized article. All right, back to our outline. We are getting close to the end of our time. So I'm going to show you a couple things really quickly. And I encourage you to ask any questions that you might have about something that you would like to see done or talked about in the remaining time. If you have no questions, that's fine, but I just want to give you that chance as I model some things for this last section here. So what a lot of people do is they'll just go ahead and they will take the instructions here. We'll grab these two here, and they'll paste them into their outline. Go ahead and use add in things, and then they'll start deleting. Say, oh, okay, that's going to be one thing. And this is clearly a sub-question. The objectives are part of how we accomplish that plan. All right, so I know I'm going to be talking about that. And I can even go in and say, okay, well, objective 1, objective 2, objective 3, and so on and so forth. Now, you might not end up with 3 objectives. If that's the case, you just go and edit your outline later and delete that. But by putting this here, when you're going and doing your reading, you can map the things you're reading about onto your outline and say, oh, well, that article underscored this need at the site that they were doing their QIP. We have that same need here. So I can write about this to take the PPE example 1 to increase the usable supply . All right. And then you can start putting in things and saying, oh, yes, aligns with, and then just stick in a citation there. So you know, oh, yes, that source I got, that article talks about that. So I can be referring to that here. And one of the beauties of this is that as you're tracking the different requirements, including that you cite at least 4 different sources, you can make sure that you have used at least 4 before you sit down to do all your writing, so you don't have to stop in the middle and go hunting for another source to buttress that point. We are unfortunately at the end of our time here. So I'm going to have to bring this to a close, but thank you very much for attending. I hope that this has been helpful. And remember, this assignment is a few weeks out. It's a end of the term paper. So whether you're watching this on video replay or you're here now, you do have time to ask your professor questions about this. So there was that earlier question about using an alternative method for breaking down the issue. And I think I will close by bringing us back to one of our slides, because I know that people sometimes have questions about that SWOT analysis and PDSA. So I included here in our slide deck a couple graphics that you can look at. So the SWOT framework is just a simple way of breaking down, okay, this is something that originates internally, and we break down the stuff that originates internally into strengths and weaknesses as the things that are helpful, the things that are harmful. Same thing with things of external origin that we have less control of. Some of those are opportunities, some of those are threats. The Pdsa process, that is plan, do, study, act, going around in a cycle, because you don't just act and then declare it done. You look at, see, okay, what's the next stage? How can we continue this afterwards? And so usually the conclusion will reference that transition from enacting the QIP, to planning what is the next logical stage to do. Like, if this is successful, we want to expand it and take it to another ward, or propose this for a company-wide or hospital-wide training session. That's all the time we have today. Thank you very much for coming. Have a great evening.